consent is lengthy. It was developed by the Board of Medicine. It was not developed by MEDCAN. This is required to be signed by every patient in the state of Florida. I will read verbatim for informational purposes only. Medical marijuana consent form. A qualified physician may not delegate the responsibility of obtaining written informed consent to another person. The qualified person or the patient's parent or legal guardian, if the patient is a minor, must initial each section of this consent form to indicate that the physician explained the information, and along with the qualified physician must sign and date the informed consent form. MEDCAN physicians review this form with all patients. We expect this as part of our certification process for patients to review this video to learn about the consented contents, and we will discuss more. The federal government classification of marijuana as a Schedule I controlled substance. They have classified it as a Schedule I controlled substance, and those substances are defined in part as having, number one, a high potential for abuse, number two, no currently accepted medical use and treatment in the United States, number three, a lack of accepted safety for use under medical supervision. Federal law prohibits the manufacture, distribution, and possession of marijuana, even in states such as Florida, which have modified their state laws to treat marijuana as a medicine. When in the possession or under the influence of medical marijuana, the patient or the patient caregiver must have his or her medical marijuana user registration identification card in their possession at all times, in the same way as a driver's license. The approval and oversight status of medical marijuana by the FDA, the Food and Drug Administration. Marijuana has not been approved by the FDA for marketing as a drug. Therefore, the manufacture of marijuana for medical use is not subject to any federal standards, quality control, or other oversight. Marijuana may contain unknown quantities of active ingredients, which may vary in potency, impurities, contaminants, and substances in addition to THC, which is the primary psychoactive chemical component of marijuana. The potential for addiction. Some studies suggest that the use of marijuana by individuals may lead to a tolerance to, dependence on, or addiction to marijuana. I understand that if I require increasingly large doses, higher doses to achieve the same benefit, or if I think that I may develop a dependency, I should contact the doctor, name of qualified physician who has certified the patient. The potential effect that marijuana may have on a patient's coordination, motor skills, and cognition, including a warning against operating heavy machinery or engaging in activities that require a person to alert or respond quickly. The use of marijuana can affect coordination, motor skills, and cognition, the ability to think, judge, and reason. Driving under the influence of cannabis can double the risk of crashing, which escalates if alcohol is also involved in influencing the driver. While using medical marijuana, I should not drive, operate heavy machinery, or engage in any activities that require me to be alert or respond quickly. And I should not participate in activities that may be dangerous to myself or others. Excuse me. I understand that if I drive while under the influence, I can be arrested for driving under the influence. The potential side effects of medical marijuana use. Potential side effects from the use of marijuana include, but are not limited to, the following: dizziness, anxiety, confusion, sedation, low blood pressure, impairment of short-term memory, euphoria, difficulty in completing complex tasks, suppression of the body's immune system, may affect the production of sex hormones that leads to adverse effects, inability to concentrate, impaired motor skills, paranoia, psychotic symptoms, general apathy, depression, restlessness. Marijuana may also exacerbate schizophrenia in persons predisposed to that disorder. In addition, the use of medical marijuana may cause me to talk or eat in excess, alter my perception of time and space, and impair my judgment. Many medical authorities claim that use of medical marijuana especially by persons younger than 25, can result in long-term problems with attention, memory, learning, drug abuse, and schizophrenia. I understand that while using marijuana while consuming alcohol is definitely not recommended. Additional side effects may become present when using both alcohol and marijuana. I agree to contact the certifying doctor if I experience any of the side effects listed above, or if I become depressed, psychotic, or have suicidal thoughts, or experience crying spells. I will also contact the certifying doctor if I experience respiratory problems, changes in my normal sleep patterns, extreme fatigue, increased irritability, or begin to withdraw from family or friends. The risks and benefits and drug interactions of marijuana. Signs of withdrawal can include feelings of depression, sadness, irritability, insomnia, restlessness, agitation, loss of appetite, trouble concentrating, sleep disturbances, and unusual tiredness. Symptoms of marijuana overdose include, but are not limited to, nausea, vomiting, hacking, coughing, disturbance in heart rhythms, numbness in the hands, feet, arms, or legs, anxiety attacks, or incapacitation. If I believe these symptoms or experience these symptoms, I agree to contact the certifying doctor immediately or go to the nearest emergency room. Numerous drugs are known to interact with marijuana, and not all drug interactions are known. Some mixtures and medications can lead to serious and even fatal consequences. I agree to follow the directions of the certifying doctor regarding the use of prescription and non-prescription medications. I will advise any other of my treating physicians of my use of medical marijuana. Marijuana may increase the risk of bleeding, low blood pressure, elevated blood sugar, liver enzymes, and other bodily systems when taken with herbs and supplements. I agree to contact the certifying doctor immediately or go to the nearest emergency room if these symptoms occur. I understand that medical marijuana may have serious risks and may cause low birth weight or other abnormalities in babies. I will advise the certifying doctor if I become pregnant, try to get pregnant, or will be breastfeeding. This next section involves the current state of research on the efficacy of marijuana to treat the qualifying conditions set forth in this section. These are conditions that are certifying within the state of Florida. I will briefly read the names of the conditions. We do not imply that every patient has every condition listed on this. Only one condition is required for a patient to be certified in Florida. But the certifying conditions include cancer, epilepsy, glaucoma, positive status for HIV, acquired immune deficiency syndrome, post-traumatic stress disorder, AML, ALS, amyotrophic lateral sclerosis, Crohn's, Parkinson's disease, multiple sclerosis, and then medical conditions of the same kind or class or as comparable to the above qualifying medical conditions, which are also called K conditions in Florida, and then terminal conditions diagnosed by a physician other than the qualified physician issuing the certification, and then chronic malignant pain that originates from one of the qualifying conditions that I just discussed. That the patient's de-identified health information contained in the physician certification and medical marijuana use registry may be used for research purposes. What that means is they won't use your name, but they will use the data. The Department of Health submits a data set to the Medical Marijuana Research and Education Coalition for each patient registered in the Medical Marijuana Use Registry. That includes the patient's qualifying medical condition, the daily dose amount, and forms of medical marijuana certified for that patient. There are other areas on this consent that says, and expect you to initial, that says, I have had the opportunity to discuss these matters with the physician and to ask questions regarding anything I may not understand or that I believe needs to be clarified. I acknowledge that my certifying doctor has informed me of the nature of a recommended treatment, including but not limited to any recommendation regarding medical marijuana. I certify that the certifying doctor has informed me of the risks, complications, and expected benefits of any recommended treatment, including the likelihood of success or failure. I acknowledge that the certifying doctor has informed me of any alternatives to the recommended treatment, including the alternative of no treatment and the risks and benefits. This final page says that the certifying doctor has explained to me the information in this consent form about the use of medical marijuana. The patient's name is printed, the patient's name is signed and dated, the legal guardian, if the patient is a minor, is added. I have explained the information in this consent about the medical use of marijuana for this patient, and the doctor signs and dates. There is also a witness line. We thank you for your attention to this informational video. This is Dr. Moore here at MEDCAN. We are helping patients one leaf at a time.